Hello friends, ankylosing spondylitis is one of the major common rheumatoid complaints that is occur in the patients, mostly in the males as well as female, but the more prominence that we often see in the male patient, and that happens to be in 20 to 40 years of the age, and in some cases the children also gets affected, which is also called as juvenile ankylosing spondylitis. So ankylosing spondylitis is the clinical term which consists of two words, that is ankylosing and spondylitis. The term ankylosing that consists that means that there has been fusion that is happening in the spinal bones, and the spondylitis that means that inflammation that is happening in these spines. So this is one of the major pathology that is happening in ankylosing spondylitis, that is there has been due to inflammation of that particular in the spines, causing the fusion of that particular spine, degeneration of the spines. So the main common symptom that has been represented by patients are lower backache. So generally the initial sacroiliac joints, that is our last joint, which is a fusion of our spinal column and hip joints. So sacroiliac joints are generally affected, and due to that sacroiliitis inflammation, the patient is continue feeling of lower backache, and which is aggravated, which is worse by a movement, especially in the morning when the patient wakes up. Patient feels a lot of stiffness in that particular area. So when disease is progresses later in the into the life, the whole spinal column that's may get affected. The degeneration of the spines is supposed to be happen in the particular patient, and this inflammation are due to long term. Sometimes it's also get fused, which is then also appears like bamboo, and it is also known as bamboo spine, which is one of the term used in some patient of ankylosing spondylitis. In certain cases, the chest expansion during inspiration process also happen, that patient cannot uh, expand his chest up to the expected marks. So these are the common symptoms associated with ankylosing spondylitis. The patient also showed some symptoms in the eyes as well. There has been a lot of irritation, redness of the eyes, and sometimes blurring of vision also is there. If it is not treated, there have been certain chances of blindness is also marked. So ankylosing, the cause of ankylosing spondylitis is considered to be one of the genetic cause. Still, there is no proper cause of ankylosing is found to the medical system, but it considered to be one of the genetic factor is responsible for ankylosing spondylitis. The gene HLA-B27 are considered to be one of the probable cause of ankylosing spondylitis, and those patient of ankylosing spondylitis who's have those person who have presence of HLA-B27 gene have probably suffer from the ankylosing spondylitis. So the treatment consists of the main motive of treatment of ankylosing spondylitis are to decrease the pain, to increase the motility of joint, or to correct the fusion, or to it should not be fuse the joint. So all these three important motive of treatment are necessary in the treatment of ankylosing spondylitis. So definitely there have been treatment modalities available, including physiotherapy, are also play a major role in ankylosing spondylitis. Modern medicine have no cure for ankylosing spondylitis, but they are useful for relieving the acute attack of pain. For a long-term solution of ankylosing spondylitis, definitely in homeopathy there have been a lot of medicines available to remove the disease from person. Homeopathy definitely will help you. The motives of homeopathic treatment in ankylosing spondylitis also to relieve the pain, relieve the stiffness, morning stiffness, to reduce the patient's effort in working, to reduce the stiffness, and also reduce the fusion or this fusion of joints. So these are the motives of homeopathic treatment, which is also we can aggressively we can decrease the patient's suffering with the help of physiotherapy. It also help you to maintain patients daily activity. With homeopathy and physiotherapy, the synergistic approach in ankylosing spondylitis are very uh, top-notch approach in the ankylosing spondylitis patients. So I hope this video is helpful for you. So thank you so much.